having me. I'm
Yay!
Nervous, excited.
Our first guest on the podcast, Miss Jaden. Welcome. We're
Thanks
excited.
for having me.
Yeah,
Glad to be here with you guys, and nice to see you guys.
I know. It's like high school reunion again.
It is high school reunion.
Another one of our classmates.
I know.
Another one.
Joins the group.
We're at that age. That's what it is. We're at that age where we're all going through baby things or some kind of baby something, I feel like.
We're closer to 30 than
Stop.
when we graduated.
I can't believe it.
We're almost
I like
30.
to think that I'm like still 21.
We are. We
At
act
heart.
like, I feel
At
like
heart.
I'm 19.
Yeah.
Constantly.
I was talking to my mom about how Craig and I have been together almost 10 years.
I remember,
like-
I'll never forget you telling me about him in
She
math class,
loves
I
us.
think it was, or French or something. I'll never forget. I remember whenever she posted that they got engaged and I commented on it and I was like, I'll never forget you telling me about him.
I love you guys.
It's so crazy. Yeah, I was like, congratulations. And then
It
you and
is.
Dylan, it's like, I don't
Same
know.
thing.
It's just same thing. It's just crazy.
I
Brought back
know.
together.
It's like we're old, but we're not. I
I
don't know.
don't feel like I'm almost 30.
Yeah, I don't feel old. I feel like I'm getting younger. Maybe I'm
Really?
just less responsible. I don't know. I could just be less responsible.
But you're more. How many Christmas trees do you have?
I have 8.
But they're not just Christmas trees. You decorate them. You get them up for Halloween, right?
Yeah, well,
I
I
love
did
it.
3 for Halloween. 2 for Halloween. 2 for Halloween.
I love that.
Like, well, I had 2 mini ones too, so it kind of depends how you. Yeah, but I did 8 for Christmas this year.
8?
Yeah,
8.
with no children, just me and my cats.
You have
and
cats?
Matthew.
How many
Yeah.
cats?
Yeah.
How many cats do you have,
8?
Jaden?
Oh, right?
Jaden has a lot of cats, so that's what
Cat
keeps me
lady.
young. I have 15.
I'm sorry, what?
Yes, I have 15 cats. I'm a cat lady from hell,
Do they
and I would
all...
never change a thing.
Are they in and out of your house?
Nope,
or
all inside.
Okay.
They will never leave because I could never lose one because I think I'd off myself. Yeah, they're like my life. Like,
Are you just, when you see a stray cat or a
Oh,
cat
I'm
that
Snow
needs
White.
adopted?
I'm Snow White. Yeah, literally. I jumped out of the car the other day in the neighborhood. Matthew was like, get back in the car. I'm like, what?
Well, like, close your eyes when you walk back to your car because we have quote-unquote stray cats. They're actually one of our neighbor's cats. They just let them roam the
out.
streets.
Yeah, I'm Snow White, so I would take them. And I would not look back.
Maybe
and
actually I
would
should
keep
let
them.
you take them. 'cause
Do you
they're
buy them
annoying.
like Christmas presents? Like, do they have to share, or do you?
No, they have so many toys. It's ridiculous. Like,
Yeah.
I go to Walmart and I buy like the 20-pack of the little mice, so my house just has like
Fake
little mice.
mice?
And I do have to say, we bought a house a year ago, and we bought a very big old house in Greensburg, so they have lots of room. But yeah, that's why I don't have kids. They're my kids. So
Okay.
tried the
don't-
kid thing, obviously. That's why I'm here. It didn't
Yeah.
work out. So they're my little substitutes. And while I was pregnant, actually, my cat was pregnant and had 5 kittens, and I kept 4.
Oh my
So,
god! Well, that
yeah.
explains
That
a big chunk of them.
Yes. So a lot of my loss that I'll talk about today, I had like with my cat. I was like, I was like, she's giving birth. I'm pregnant. Like, I need these cats. It was
Really?
crazy. Yeah.
That's wild. So yeah, that's
We were pregnant
why.
at the same time.
That's
yeah.
cute.
Yeah.
Sometimes you do it with your best friend or your cat.
Yeah, or your
maybe
cat.
your dog.
or your dog, whoever you could share the experience with, to be honest.
Yeah, that's why we have Jaden on here today. We're going to be talking about a pretty sensitive topic, miscarriages. So if this is something that relates to you, we're hoping that, you can find comfort in knowing that you're not alone and there are people out there. I don't think it's a topic that's talked about enough. I haven't experienced it myself. I don't know if you can agree to that it's just
it's
not
definitely
spoken about
something
enough.
I've never really I didn't talk about it at all just because I felt like I didn't have anyone to talk about it with, just because I don't know anyone that has openly talked about, it's one of those things where I think if it happens, people don't really say anything about it, and they try to, or normally it's early, or normally it's they don't know how to help you cope, so they just kind of are like, oh, it's okay, but I didn't really have anyone to talk to, so I didn't really talk about it, because it was like, I didn't want to be a burden, like, just because it was such a
tragic thing.
It was just like horrible, and it was like, I felt bad for Matthew and like my mom. They were like my support system, so for them it was just like me constantly bitching or crying or something, but like, how else do you feel?
Going through all the emotions, I'm sure. I mean, it's a grieving process.
Yeah, and I still think, to be honest, it's been, so I lost last July, and I still think I'm affected. I really do.
I think you will forever be.
I think so too.
I don't think it's something that'll go away.
Like my doctor about like postpartum depression and things like that, because I ended up having I terminated my pregnancy at 5 months to save my life is what ended up happening. So obviously we'll get into that, but it was very much so like, did my body feel like it gave birth or did it feel like it lost? And like, am I suffering depression from that? Like, because the baby was taken from the womb, basically. Like, yeah, very, very weird emotionally and like biologically feeling, I think, for sure. Yeah.
And it's probably weird to call it postpartum because
it's
you
not.
didn't have the baby, but you had all the hormones and the
Right.
emotion. So, I mean, that's basically what it was.
Yeah, I was 5 months when I lost. So.
Yeah, if you want to start maybe at the beginning
start
where you
from the
found
top.
out. Where
So,
you found out and
something that, and it was funny, we were just talking before we started, guys, was Izzy even was, she kept telling me that she was predicting my baby. She was right. Yeah, and you kept saying, you're going to get pregnant, you're going to get pregnant. So Matthew and I had what I assume now was a miscarriage, and I had no idea I was bleeding, just horribly bleeding. And I was doing visual management at the time, so I was doing like displays and stuff for Dick's Sporting Goods. So I was like lifting like these big mannequins on ladders all the time. So I was starting to feel like super, super sick. And about a month later, I started to feel really sick, and I thought it was my diabetes because I'm type 1 diabetic. Right. So, and I'm the worst diabetic. So I was like, maybe it was that. I don't know, whatever. And work just kept getting more difficult. Finally, I went to the doctor. I had a little pouch on my stomach, and I was pretty thin. I had done the keto diet, ended up in the ICU for a while because I'm just a disaster. Yeah, I'm just a medical mess, but I just don't tell anyone. I just go through the motions. So I noticed a pouch on my stomach, and I couldn't lose it. So I went to the doctor, and I found out I was 3.5 months pregnant.
Oh, my God.
I had taken a test the night before, like a night or two before, because I got an ASAP appointment. But my mom was like, "Oh my God, this is amazing!" You know, everyone was all excited.
Were your periods just?
I had regular periods.
Oh, you just
Regular
didn't
periods.
really pick up on.
No, I guess probably a little bit irregular, but like I was always pretty irregular.
Yeah.
So nothing crazy. Like I was still bleeding like normal, and
you were still getting your period.
Oh, I was still getting a period. Yeah.
Wow.
Yeah.
I've heard of that happening. Yeah. That can happen.
It was terrifying because I had no.
Because you always wonder how people go so long without knowing they're pregnant, and sometimes you still get your period.
I thought it was just weight gain, and then I just like didn't feel good. So everyone was excited, and I had no idea how to feel, simply because I had just been in the ICU for my diabetes. So I found out I was 3.5 months, and as a diabetic, they told me the baby could have no heart, no brain, or no spine if the blood sugars weren't correct.
Wow.
So my blood sugars were totally not correct.
Those past few months.
Yes, like at all. And there's like an A1C number that you have to have like a certain A1C to basically have a healthy pregnancy, and mine was not. So I was terrified, and everyone was excited, but I
was excited.
Everyone was excited. I mean, and not that I tried not to be, but I just felt.
You felt like something was wrong.
Yeah.
I remember the whole time you're like, I remember like talking about this. You're like, I really just don't think I should have this baby.
Yes.
And I was like, I'm like, obviously do what you need to do. Right. I'm like, I really want you to have this baby. Like it will change your life, but you knew something was off.
Yeah, something I just could tell. Like I just couldn't get excited. I never wanted to be a mom, so that was also difficult, and it just put me in a really weird, like, is this where my life's supposed to change? But I just felt awful. Like, every day I felt awful. So I ended up quitting my job at Dick's Sporting Goods because I couldn't physically do it anymore.
Wow.
And I was that sick, and I gained 22 pounds in my first trimester.
Wow.
And they told me it was normal. And I was like, there's no way this is normal. I'm diabetic. And they told me I could have up to a 30-pound baby because of the diabetes.
What?
Yeah, so
I've literally never heard that.
Yeah, they said a diabetic baby can be
Is that
huge.
like a Guinness World Record? 30-pound
like
baby?
You could give birth to a 30-pound baby?
I guess so. I was not trying to come close. I was not even trying to, I don't know.
Our babies aren't even...
Right?
They're still not 30 pounds.
Isn't that ridiculous?
They're like 15.
Yeah, I guess it's just something with the diabetes. I don't know.
So were your doctors making you feel more worried?
So my
sounds
doctors
like maybe
were actually like totally ignoring my
concerns
completely. When I ended up being in McGee at the end, they told me I should sue, and I'm not one of those people. So, and I don't know how that works anyway. I'm not that smart. I went to Hatfield. So I know you guys are all smart. I'm over here like,
no, we're not.
Yeah, you are.
You were in calculus with me. I'm pretty sure.
Girl, a lot different than filing a lawsuit. I'd be over here like
that's just like a lot to drag out too.
And
yeah,
like when you go through all the emotions, it's like the last thing I feel like thinking about is money, I guess. But
so do you feel like your doctors had a
huge part
in your decision or
and like I think
how
failing
things...
to like how it ended. So
okay.
they basically, I went to 4 appointments, and every single appointment, including the very first one, I said to them, I don't think I should have this baby. And they were handing me coupons for diapers. And they were not giving me any information on termination whatsoever. Like not one piece, nothing. Not even like call Planned Parenthood. I mean, nothing. So I was thinking to myself, okay, I'm diabetic. I probably have to stay in my doctor's care. This probably isn't a Planned Parenthood thing anyway. Like, I probably have to be with a specialist because of my like high-risk pregnancy, because that's what I would be considered anyway. Never any info. So I kept telling them, I kept saying, you know, I don't feel good. Oh, I think once you talk to, you know, fetal medicine, I think you'll feel a little bit better. Or, oh, I think once you talk to the head doctor, once you're a little bit closer to 20 weeks, you'll feel a little bit better.
You know what? They do that. Even though I had a pretty normal pregnancy.
Yeah.
Especially if you're going through it for the very first time, you don't know that being sick every single day. I mean, morning sickness, probably nothing compared to what you had, but I lost almost 10 pounds.
Me too.
In my first trimester.
Serious?
Yeah.
Just from like being sick and
I couldn't hold anything down.
The first
and I would tell
trimester...
my doctors, and they would be like, that's normal.
Mm-hmm.
I'm like,
you're like, thank you for caring.
Yeah, I'm like, nobody's acknowledging the fact that you make me step on the scale every time. Why? You're not concerned that I'm losing weight.
Right.
But God forbid you gain too much weight.
Yeah.
You know?
It's like either way, they just don't, I think they just like don't know, so they just go with the emotion.
And
like,
we have another episode out there about postpartum part 2, and we talked about how they treat every single patient. Doctors just treat you like every single patient.
Yeah.
You're the same.
Yeah.
They don't personalize it to you. I mean, every appointment I would walk in there, what's your date of birth? And you get down to the last month, and you're telling them the same information every single week.
You're like, you should know this by now.
I should just sticker it on my head. Like, this is me. I'm here every week. Do you not know me yet?
Right.
Mm-hmm.
You know? And your situation was, I feel like, very unique. I mean, being a diabetic, I think that alone would cause concern for you and your baby.
Right.
So.
And they kept telling me to wait until I got to like I guess it was like the fetal medicine team. Like there was like a team that would handle it, but only later in the pregnancy. And I'm like, why do I have to wait? So I went to 4 appointments, and finally, so I had started, and if everyone knows how I like my coffee, I drink 2 large coffees a day, whether it's Starbucks, Dunkin', whatever. They told me no caffeine, and they took me off of all of my psych meds. And I'm bipolar, so I take a bipolar medication, and I was on a depression medicine. So they took me off all of that. And
it's like withdrawal.
Yes.
And all at the same time, all those
At the same time, I'm finding out I'm pregnant, you know? So I'm like, my life was just different. And I'm like, how are you guys going to tell me no with everything I've been doing, which for good reason, I get it. But like, all of a sudden, everything's cut off. I'm like, I left my job. You know, I got a closer job in Greensburg that I hated, but just because I was close to home at least. But, you know, everything changed. So it was just very much so.
Abruptly.
Very abruptly.
And they still were not giving you many answers.
No answers. So they just kept saying they wanted me to wait until I was 20 weeks to have the anatomy scan. And I'm like, so you're telling me that this baby might not have a brain, a spine, or a heart, and you want me to wait until I'm 20 weeks to find that out? Like, I'm sorry. Like, and
they wouldn't do an internal sonogram?
I guess
I did an internal one at like 10 weeks.
Are you serious?
Maybe 12
Did
weeks.
you not get any type of sonogram?
I had just my ultrasound. That's
Your
it.
ultrasound?
At 20 weeks? Or
no, I had one at 13 weeks.
Just to know that there was like a baby in there.
That there was a baby. And then when I went into McGee, which will be like the severe part of the story, I had 2 done.
But I guess that early on, they really don't have.
They don't, because they only do the first initial one, and then they do the anatomy scan.
Yeah.
But if there's raising concern of you don't want to have this baby, why are they making you wait until you're halfway through your second trimester?
Right, exactly.
That's just like, that's so messed up.
Zero. And I'm not one of those people, like, believe what you want to believe, whatever, but zero information on termination. So I was like, I guess I'm keeping this baby. Like, you know, like, part of me is like, okay, like, there's women that would kill to be pregnant. That this is, like, the biggest blessing in the world to some people, so I need to feel grateful.
Yeah.
And that was, like, the hardest part for me, because I felt like I wasn't very grateful, but I also felt like something was wrong. So I ended up quitting my job in Greensburg because I couldn't even work, and I couldn't breathe.
Still so sick.
Yeah, I couldn't
How many
breathe.
months?
This was I was about 4.5 months. So I couldn't breathe was the new thing. And I went to the doctor, and she tried to send me down to the psych place in Greensburg. And she said that it was just stress. It was just this. And maybe there was a way that they could help me with my anxiety. And I'm thinking to myself, like, lady, I can't breathe. Like, this is not anxiety. I physically just can't breathe. So she said, well, then you need to go to the ER. So I lost all of my health insurance because I had to quit my job. It was a disaster. So thankfully I got it through the state. That was a whole shebang. Went down to the ER and they took me and they found a massive blood clot in my lung.
Oh my God.
In my pulmonary artery.
In your lung?
Yeah, in the main artery. So
what?
Don't know. So it was like
I never even heard it. I didn't never even think that would be very alarming to me to have blood in your lungs.
Yeah. I was like, why is there a clot in there? Like, how would they're asking me questions about the pregnancy. How far are you? They sent me back for I guess it was a CT scan is whatever it was when you go inside the tanning bed looking thing. The tanning bed. Yeah. But of
basically.
course it's all I can think of. But it's fine.
It does actually.
It looks like a tanning bed.
Yeah.
But can we just put some UV lights in there?
Yeah.
Not feel like one.
It does not feel like a tanning bed. But I went in that thing and it was like panic. Like these doctors were flying in here. I was getting strapped down to this thing. They're like, you're on your way to McGee. And I'm sitting there like, Matthew's at work. He has no idea.
I was going to say, you're by yourself.
I was by myself.
Wait, you were at the local hospital
Greensburg,
at this point.
yes. Okay. Thank God I was in Greensburg. And at the time we still lived in Jeanette, so it was still a little bit local. But they were like, you're going down to McGee. You have a massive blood clot. We can't handle it with your high-risk pregnancy. And I'm like, I don't know what that means. Like, what does that mean? Like, where is there a clot? How to get there? Like, there's no answers. So one of the main OBs from Greensburg, Dr. Turkowitz, I don't know if you guys have ever dealt with her, but she happened to be at the hospital and she stopped in and she sat on my bed and I was bawling because I just had no idea what was going on. And because I thought I was going to have a surgery in my chest or something, like, get into my lung. I'm pregnant with this baby.
What does that mean for the baby?
Sucks.
Yeah,
like,
for
what
you.
does this mean? Right. So she sat down and she was like, how are you feeling? And I told her, I was like sobbing. I was like, your doctors haven't helped me. I haven't felt good in months. I'm like, because she's one of the head doctors. I said, and all of a sudden I have this clot. I don't know what that means. Like, what is going on? I don't want this baby, but I do want this baby. Like, what do I do? And she was
scared.
Like, I was terrified.
Scared.
She was like, just go down to McGee and whatever happens, like, will happen. And I'm like, okay, like, thank you. Like, she was like, whenever you need a follow-up, come see me. I'll bring this up to the practice or something. So I'm like,
bring what up though?
I guess that they like ignored like my concern.
Okay.
I guess.
Okay.
I was like sobbing. So I don't know. So
you're being rushed to a whole new hospital with different doctors you've never even seen.
Yep. Mm-hmm. And they had me hooked up to all kinds of stuff. Like I was on like a breathing machine and stuff and
like oxygen. Mm-hmm. Okay.
So they sent me down to McGee with nothing, and I get there with nothing. I'm hooked up to nothing, and I'm just sitting there
by ambulance.
By ambulance. Yeah. Matthew came down after work and was able to leave work and come and met me. And I'm just sitting there, and I'm like, I have a blood clot in my lung. Like, I can't breathe. I'm sitting here with nothing to help me breathe. What? I have a baby in my stomach.
And at that point, are they concerned to check on the baby?
No,
or
not yet.
No.
Haven't even. Okay. In Westmoreland, they did not check on the baby once. No heartbeat, nothing. Like, I was like, what is going on here? Like, I just felt like it was just a mess. I don't know. So
yeah, don't you think they would even like? Didn't they always like with a stethoscope listen for like the heartbeat or even a Doppler?
Yeah.
Like, don't you think they would have like listened?
Check on the baby too.
You would think. They literally told me that because I was high risk pregnancy that they couldn't even admit me into Westmoreland.
So just straight to McGee.
Straight to McGee.
Okay.
That was it. So I'm like, so you guys basically just didn't give me any care. You're just shipping me away. Like, perfect. Thanks. So I got down to McGee. They checked the heartbeat as soon as finally someone came in. They didn't check me or anything, but they checked the baby.
Okay.
But they put me on the new mother's floor, which was a little bit traumatizing. So they put me in right next to someone who had just had her baby that day.
Oh my God, you had to share a room.
No, she was like right across.
Oh, okay.
Like the rooms there are like they're like catty corner, like diagonal. So like if you open my door,
yeah, I've been there.
Door,
yes,
I could see like right in.
Yeah, okay.
So she had just had her baby. Everything was good and happy, and I'm sitting in this room with Matthew, and we're like just traumatized already. Like, we're like, okay, like, I don't know what I want to do with this pregnancy. We don't know if the baby's healthy.
Yeah.
All we know is that there's a heartbeat. I sent out to do a gender test, and they didn't give me the results yet, so I didn't know what I was even having yet. I did the early one. And now I'm like, now I have this blood clot in my lung, and I can't breathe. Like, and I'm sitting here, like, in this hospital with no support, really. So, about 2 days go by, and they send me these images of the clot, and they're talking about the clot. And basically that they need me on a blood thinner, but you cannot take a blood thinner while pregnant. It has to be injected. So these shots that they said that I had to take, they were called Lovenox shots. These Lovenox needles were like...
And you're diabetic, so you're used to needles.
And I'm used to needles. And these needles, I was not used to these.
Oh my God.
It was so painful. I had bruises up and down the entire, it looked like the side of my body was tattooed. It was just bruises. I had like 15 to 20 bruises.
And you're still waiting for answers.
Still waiting for
why
like
this
really
happened.
exactly like why do I even have this? What does this mean for a pregnancy? Like that's why I'm at McGee.
Yeah.
Like this is supposed to be the best women's hospital like in
the area.
Yeah. In like half the freaking world.
Right.
So basically it was no answer on the blood clot. It could have been from 1 having COVID in December, 2 the circulatory system forming of the baby, or 3 being diabetic.
All 3 put together.
Yeah.
You know?
They have no idea. So massive blood clot, and it was called a chunky clot. I actually still have it. So it was so big that it was one that just, you basically just treat it with blood thinners and it'll eventually go away. But it was called a chunky clot. So it was a nice big clot. So to anyone listening that knows anything about blood clots, hit me up.
DM.
We need more answers.
Yeah, slide in. It's SupJJ on Instagram. No, because I still have no idea.
Well, Craig's cousin is, and we were supposed to have an episode with her, which we will soon. She was, I don't know if she would know much about it, but she was a like postpartum nurse essentially, and she's now a NICU nurse. So when we all had our birth stories, and I don't know if you listened to Sam's.
I didn't listen to Sam's.
Okay,
I got through some of it, and then I had to go to work.
Seriously, you're on our show. You know.
No, I'm sorry. I need to listen. I need to finish listening.
But Sam's experience was pretty traumatic, and she didn't necessarily have like answers per se, but she knew why a lot of the things happened. So that's why we want to have her on to kind of clear something up.
Clear
maybe
up some
Katie,
questions.
hey, if you know about the blood clots, let us know.
Yes, let us know, please, because and they told me it was like the number 2 reason why women did pass, like during pregnancies and things, and during birth. So I was
women
like,
would not make it.
Yeah.
Wow.
So I was in there for 12 days. So this was around day 2.
In the hospital?
In the hospital.
At McGee.
And on the new mother's floor.
Yeah.
So you're just seeing baby after baby.
And you're hearing them.
Mm-hmm. I'm hearing crying. I'm hearing, oh, yay. I'm seeing balloons. I'm seeing all kinds of stuff. And I'm just there, and Matthew would come see me, go home, and I just would wait every day and was like, what am I supposed to do? So every day I'm sitting there, they're telling me to basically, without asking me, to make a decision about this pregnancy. And they're hinting to it, but they're not asking me to. But they're telling me that they can't send me home, basically, without either me being on a home health nurse giving me these shots 3 times a day if I kept the baby. Or they can send me home on a blood thinner without the baby. Yeah. And those were my options.
And not without the baby.
Without the baby. Okay. Yeah, without the baby. So I'm like, okay, well, how are you guys going to make it? The one nurse actually said to me, are you really going to pick not taking shots over your child?
Oh my.
What she said to me. So it was very much so traumatic. But, and like I said, these shots weren't just shots, because I am diabetic. I take shots all day.
That's why I wanted to make a point of saying that.
They weren't just shots. So if any other woman is going through, like, it was horrible, and they burned.
Not to mention, you still have no answers.
No answers.
You don't know why this is happening.
Mm-mm.
You don't know really what, like, there was nobody there to tell you, if you do these shots, these are the possible outcomes.
Right,
Or the possible, I don't want to say side effects, but
like what would happen, basically.
Right. Yeah, like what if you kept doing the shots and your baby still didn't have like a brain?
Right, exactly. I still had no idea.
And you had to like, okay.
Yeah.
That's so messed up that nurse said that. Because like, what would you do?
Right. And I was waiting for like someone to be really logical with me, because at this point, like, okay, my cats are my life. My cats are my babies. At this point, when I was in the hospital for the first time in my pregnancy, I felt super connected to my baby. And I think it was because that was my baby, like I didn't have my babies at home. I was in a room, just you alone with this baby in my belly. And I was like almost 5 months pregnant. I turned 5 months pregnant while I was in the hospital. Wow. So it was like, at this point I was biologically becoming like attached, and they're asking me these questions, and every day no answers. So I'm asking them, like, is there any way I can take, maybe the oral medicine and the baby will be okay instead of these shots? No, it will, it'll go through the placenta and give the baby a brain bleed. That's what I would be told. So I'm like, okay, then what if I don't get, I don't know, what if my insurance doesn't cover a home health nurse? Mm-hmm. Well, then you have to give these shots. Okay.
Give them to yourself?
I guess, yeah, which I don't even know if you can. Like, they kept asking me if I knew anyone that was a nurse, because I think they were like large grade needles. Like, I don't think it was something I could even take home. I think it was like a prescription thing.
Oh, okay.
So, Lovenox, or there was another one that you can take. And I guess a lot of women do it whenever they are in the hospital, of course. They also told me that if I kept the baby, I would become a long-term resident at McGee.
What does that mean?
I would probably be there my whole pregnancy.
Oh, my.
Like the rest of it?
Yeah, or at least like towards the end of it, because of the diabetes. So basically with me having the blood clot and being on a blood thinner, I would have to have a C-section being diabetic, more than likely because of the big baby risk. It was like the one thing. So they had already told me in the beginning.
My aunt is a diabetic, and she had
have a regular baby?
2.
A regular baby.
Regular delivery, yeah.
Yeah. I mean, I don't know if she had any complications, but I'm pretty sure she had
vaginal.
Like a vaginal birth. Oh, is that what it's called? Oh my God.
Regular.
No, it's okay. I'm trying to work on that too.
See,
like I try to say
I'm still
people are like a normal, and I'm like, it's vaginal, or
they're all normal.
They're all normal.
They're all normal, but they're different normals.
Right.
Yeah.
Correct.
Some people's normal is different normal.
So they off the get, they knew it was gonna have to be a C-section.
Yes, they told me C-section because they asked me. Remember whenever you first go in and they ask if you want to breastfeed and how you want to give birth? Did they ask you those?
In your appointments?
Yes.
Yeah.
Okay.
Yeah. There's like each appointment is like different checklist things. They just go through a checklist. That's the other thing I hated.
They asked me, and then
like,
they
do
said
you want to breastfeed?
C-section.
Wow.
Yeah. Yeah, I told them no to breastfeed because I asked about having my nipples pierced. They said, girl, it doesn't matter. I was like, it doesn't?
No, it doesn't.
Well, I mean, you would have to take them out, right?
Yeah.
Baby.
I was like, won't it? Like, she was like, no.
Want it?
Normal. I'm like, won't it like split? She's like, no, a lot of women do it. I'm like, oh, okay. I'm like,
I have no idea how that works either.
I don't know. I'm like, I'm just new here, But, so it was very much so like, you need to kind of decide what you want to do. And every day I would get no answers. And I'd be like, when am I going home? And they would be like, did you decide? And I'd be like, decide what? Like, what? Like, I have to pick my,
right now today, I cannot be released to go home, sit in my house with my family, process this information. You have to stay in a hospital setting surrounded by a bunch of new babies in there.
Yep.
Which is obviously like almost probably swaying your decision. Because I feel like they didn't want to say the word.
They didn't. Mm-hmm.
But your life is on the line. And this baby's life is on the line. So like the more time that passes, like it's going to get harder and harder for you, especially being around all these new babies to, I don't really know, like, terminate it.
Right. Absolutely. And that's what it was like, you see all these like gorgeous moments happening in these beautiful families, and I'm like, okay, this is something I never like wanted, but like, is this what I do want now? Like, and you're sitting there, and I have this, and mind you, they check the heartbeat 3 times a day when I was there. So now all of a sudden I'm getting more attached, like I said, because they're coming in, they're checking on the baby. They're, baby's moving, everything sounds good. Of course, we still don't know if it's healthy or not. They're not asking to do any of this testing while I'm there, which
and at this point, you could 100% be doing ultrasounds.
That's what I mean. I could be doing all kinds of stuff. Yeah.
That's so wild, because I know a few women who have gone, who are pregnant through IVF. And that process, they are monitoring things every step of the way.
Really?
I think she has an ultrasound almost every appointment.
Oh my God.
Yeah, she has a lot of ultrasounds. Super
nice. It gives you a lot of like peace of mind.
Yeah, I forget who else. Somebody else I know that was pregnant. I don't think it was through like Excella. I don't know who it was through, but the doctor that they went to see always had the ultrasound in their room to do it. Wow. So they literally got to see if they wanted. They got to do
every time if they wanted to.
But you would think, with all the concerns, and they want you to make this decision, but you still don't know anything about your
because at 5 months, so it's probably like 19, 20 weeks.
Yep.
You could have had
I could have done the anatomy scan.
Yeah.
Yep. But they weren't. That was off
Did
the
you
table
find
now?
out?
I never found out, and then they actually never sent me my gender results.
Would you want to know?
I would. Yeah, I was gonna call and ask. The one day I went on my Excel chart, and I was hoping that it would be there, and they never posted it.
Really?
Mm-hmm. Yeah, really weird.
I feel like it would help you maybe like grieve a little bit better too.
Yeah, and I had names picked out and stuff like that, so I think it would help with like closure a little bit, or like just to know, because we wanted one more than the other, and I wanted to be a boy mom, so I wanted that. Yeah, I wanted that more than the other, so it was like whatever. But
also like a little mini J, like.
Girl, I don't know if I can handle another mini. One of me is enough. But Matthew would have a heart attack. My whole family would be like, "All right, that's enough." But yeah, so it was like every day was psych would come in and talk to me for hours. Okay.
About what?
How's your anxiety? I'm like, girl,
Well, I'm sitting
you
in
want
a
to talk about my
hospital.
anxiety because I will talk to you about my damn anxiety. Like, and I would sit there and the one lady I was like screaming at, I felt really bad, but I was like, and like not even to be, I was not exaggerating. I was like, I do not want to be alive. I'm like, this is horrible. Like, I don't know. I have this baby. I'm off all my medication. I don't want to make this decision. Like, who wants to make this decision? You know what I mean? I feel like horrible. I'm growing a child. Like, is this baby sick? Like, what, how do you even process any of this? Like, I don't have a job. At this point, I didn't have a job. Matthew was supporting us, and I was a worker my whole life. So I'm like, lady, I'm feeling all types of crazy. I want to go home. Like you said, I want to like process this.
Yeah.
I have a blood clot in my pulmonary artery. I can't even breathe. I still can't breathe. And it's like, how in the hell am I supposed to make this decision on top of all of this? Now all of a sudden I'm coming into the hospital with a baby and leaving without one. Like how horrible.
Right.
So that was like every day was either a social worker, anxiety or depression people. The doctor would come in every once in a while and just ask me how I was doing and if I thought about anything. That was it. It was a guy. He was super polite, but I was just kind of waiting for someone to just be like, Jaden, this is what's going on.
Yeah.
And finally, it was day 8. A lady comes in. Blonde lady, I'll never forget. I don't know her name, but she was like my saving grace. She was a badass bitch. She came in and she was like real, they must have called her in because I was in there for a long time, so they're probably
we need to back up.
Somebody we need backup, girl. Like, because, what was I supposed to do? So finally.
You needed somebody to come in there and just lay it out.
Yeah, and
be
just
blunt,
tell
you what's going to happen.
Exactly.
And you know what? If they wanted you to make the decision to end the pregnancy, why wasn't anybody telling you what that looks like?
Exactly. Because I had no idea what that even meant.
Right.
No idea.
At that point, 5 months along, what does that look like?
Right. Exactly. I'm like, that's second trimester.
Mm-hmm.
Like, this is no longer just take a pill. Like, I have a baby in me. And so finally this lady comes in and she sits down and she was like, listen. She was like, I'm deeming your pregnancy life-threatening. She said, here's the paper. She handed me this paper. And it said on there, life-threatening pregnancy, whatever. She signed off on it, stamped, doctor, whatever. She said, if you want to end this pregnancy, it's taken care of. She said, you don't have to pay for anything. She said, everything's taken care of. She said, just please, she was like, I will let you know it's a 70% chance that you won't make it if you carry this baby.
Okay. We thought the same thing, like if you get terminated.
Like,
wow, okay. So those are like real numbers, statistics.
Real statistics, she said, and she brought it up again. She said that it's the second biggest reason or whatever that women die during pregnancy or during childbirth. She was like, this is a serious thing. I really want you to think about this. And I was like, oh, like finally someone like really kind of like I needed this lady 8 days ago.
Literally.
Right? Like just to tell me this is what.
That's a big percentage.
Like. Huge percentage, especially like she said because of like the possibility of C-section bleeding out is I guess the biggest thing that happens with women is with the blood thinner. You can bleed out during a C-section or I guess even just during a vaginal birth.
Yep.
Is the blood because they don't know when to stop the blood thinner or to lessen on it as you
because
get closer
of the clot.
To delivery.
Right.
Yeah. So I was like, okay, well, there we go. So I took another 2 days to think about it. Still didn't it's the worst decision you have to make in your life. It was like, again, every day they're still checking the heartbeat, which was so hard because you sit there, they come in, they're like, oh, baby sounds good.
Are you kidding?
Swear to God. I'm like, okay, thanks. And, Matthew's sitting over there like, baby, what are we going to do? And Matthew started to get, like, very, like, we're done. Like, we're not having this baby. Like, you need to seriously,
he was thinking of you.
Yeah, come back to reality. Like, I know you might feel attached, but, like, I'm not you right now. I'm looking outside, looking in, and, like, you want to be alive. And he even said to me, he said, if I were to leave this hospital with a baby and not you, I couldn't do it.
No, that's a lot.
Yeah. Yeah, so it was
This is a lot of things to process.
A lot.
Very quickly, and... yeah, it's like, how do you feel? Because, like you said, you weren't trying for the baby when it happened. So it wasn't even like you knew this was a possibility. You know what I mean?
Right,
like,
exactly.
It wasn't that you guys were planning this.
Right.
And now the plan's changing. This is a whole new reality that you were not
Right. I wasn't anticipating it at all. And it was like our whole life had already changed just from me being pregnant, not being able to work, not feeling good. He was now like the breadwinner. We were actually also in the process of buying a house. So that was like we were looking at houses that were, 4 bedrooms to have the baby. And now it's like, okay, do we look at a different house now? Like, do we need less bedrooms? Am I coming home with no baby? Like, what does this look like for like our reality just in general and like planning? And it's like, do I have to start looking for work? Like, this is just, everything was changing. So I do have to say Matthew did finally help me make the decision. I kind of did put a lot on him and I feel bad, but I was like just not in the state of mind to make that, just like, how can you make that decision? It's like, I mean, you could, but you can't at the same time. So the night before of my surgery, which I had at McGee, they took me for an ultrasound to see how big the baby was.
But like, why now?
Tell me.
Yeah.
How big was the baby?
They turned the screen off.
What? Because they knew.
Yeah. Yeah.
Are you glad they did that?
Yes. I was like, I literally, whenever the doctor said that I had to have an ultrasound.
That'll loop you back around.
Yeah. I was like, can you please tell them to turn it off because I'm not having the baby? And she was like, I'll tell them. Thank God. Okay. Because if I would have went in there and saw that, I would have been like.
Right back to square.
Yeah, I would have been right back to square. Because how would you
not?
I had to, at that point, like, stop thinking that this was my baby. I had to start thinking, like, this is, like, an organism that is attached to me that is taking away from my health is, like, kind of how I was trying to think about it. Like, a little bit more, like, biologically, I guess. But, so I went in the morning, and then they messed up my procedure. So, so I went in the morning at 4 a.m, and my surgery was scheduled for 6. So I go into the room, and they give you these pills that helps dissolve anything in the uterus. And they put these pills under my tongue, and I had 6 of them. I'm sobbing, the whole morning. I'm a mess. I'm bawling my eyes out. Matthew's, like, doesn't even know what to do anymore because I'm just so numb and just horrible. And they give me these pills, and they told me that I cannot have any birth control at all because of estrogen can mess with the blood clot. So that's another thing that Katie might know. So. Yeah. So I was like, okay, sounds good. I don't know what that means then because, of course, we weren't trying, but, like, what birth control, so they gave me an IUD. They gave me the copper one. So they gave me this paper, and they were like, you have to sign this paper, and we'll do it during your procedure. We'll insert it as soon as we finish your DNC. I do it all at once. So they give me the pills. Everything starts dissolving. Horrible cramps. Horrible. I'm bawling my eyes out.
They didn't warn you about that?
No. They said it would hurt a little bit. They said that I'll get, like, some cramping, but not as bad. So they lost my paper with the IUD. So it was an extra, like, 3 minutes I'm waiting. My stomach was in so much pain I stopped breathing because it hurt so bad. Like, the cramp was just, like, unbearable because at this point I was supposed to be asleep already. But because of that extra 3 minutes or whatever, they lost the paper. I was already supposed to be under. So I was literally, like, feeling this, like, happening. And I remember looking at the anesthesiologist, and I was like, this hurts so bad, I can't breathe. And she goes, it's okay, everything's just churning up in there.
What? Mm-hmm. That just made me sick.
I literally passed out right after she said that. I was gone, out, and then they grabbed me with the...
Those were the last words.
Those were the last thing I remember. And then I woke up in the operating room, and I said, girl squad, because there was a bunch of girls. That was the only happy moment I remember. I woke up and I said, girl squad. And all I remember is my anesthesiologist looked like Snoop Dogg, but she was a girl. That's all I remember. But, yeah, so they lost the paper. So I had to endure another little bit of trauma there.
That was, like, the most insensitive thing you could possibly say.
So they put me down so hard that I woke up 5 hours after the surgery, and most people woke up an hour after. So Matthew thought I, like, died. Oh. He was, like, looking for me and couldn't find me.
Like, you weren't in the post-op room at that point?
I was, like, in the back wherever they line up the beds or whatever. Okay, I woke up and was like, what's going on? And I woke up, and, of course, it was, like, traumatizing because they're checking on me. And and I remember the first thing I said when I woke up was, am I still pregnant? Mm-hmm. And they said no, and I fell back asleep. So... yeah. So after that, I was able to go home that day. It was a lot of bed rest for like a week because it was like a surgery, and because I was bleeding pretty bad. And then thank God I didn't have to endure the IUD because I hear like for women that have gone through that, I heard it's horrible, like absolutely painful.
Just getting the IUD alone.
Yeah, I heard that's horrible. So thankfully I was asleep for that part because you aren't asleep, I guess, and like
normally
people get it done. So I didn't have to endure that, but I did endure everything else. So, yeah. So I got home and I was, I didn't work for a month. I wasn't allowed to work. My doctor signed off on something. In the midst of all of this, I had actually filed for unemployment and got declined. So that was a disaster because my doctor signed off that I couldn't work because of the blood clot because I couldn't get COVID. And I had always worked retail. So it was like, what was I supposed to do? All of my whole career was retail management. So I actually last week found out I won the court case, and I actually won my unemployment case from last year. So
Wow.
You'll be getting a check.
So I'll be getting a check, thank God, which helps for just like that little period of time. But that will help a little bit. I mean, nothing will ever suffice for everything I went through, but not being able to work like really killed me because that's like my thing. Like I was always a worker. So for me to not work, lose a child, it was just a lot, man.
Yeah.
It was a lot.
Yeah, like you're a full-blown adult. You need to pay your bills.
Yeah.
You can't, I mean, it's not just...
But, like, also your health. Like, you can't work if you're not healthy.
Yeah.
Right.
So...
And my doctor's like, we don't want you around the public. What if you get COVID? What if you get sick at all? You have this clot in your lung. And I'm like, I don't know. And then disability wouldn't accept me either. So I'm like, well, what am I supposed to do? I'm like, I've never had an illness like this where, like, I, like, provoked from a pregnancy, you know? It's all new to me. So...
What was post?
Post was horrible.
Like, yeah. What did you have to go back? Like,
nope.
To the doctor?
They never wanted me to come back unless I had any complications. Yep. So I made my own post follow-up. Actually, I went this past summer. It was almost a year. And I wanted to just make sure everything was okay. Mm-hmm. Because, one, I had an IUD installed during, I guess you could call it like a tissue removal. So I wanted to make sure nothing moved, you know? Like, I had a whole DNC done, and then they installed an IUD or insert, I don't know what you call it.
Yeah.
But,
Install.
Again, my words, I don't know. Viewers are probably going to be like,
your car.
Yeah, I'm thinking of vehicle things. I'm thinking of,
You are a car girl, so.
Yeah, I am a car girl. I'm like, you know, and that last time I installed that part was, you know. But,
installed the part of the IUD control.
The last time I put the IUD in. But, so I went and she said everything looked okay with IUD. And she just basically asked, like, how I was feeling. And it was just so basic. And I was just shocked that
this is almost a year after, though.
Uh-huh.
So nobody checked on you to see how you were feeling.
Not at all.
Before that.
Nope.
Wow.
Or
like I said, they never even uploaded the results of the gender test or anything to my portal.
Or to even ask if you wanted to know.
Yeah, they didn't even ask.
Or like, here's a referral to some therapist.
Yeah.
Or
the only person that did help was I got a social worker, and I still see her because technically, like, when I guess there's like a checklist that if you are still in like therapy or things like that. So I did go to intensive therapy with Mickey after. Did not help. Very insensitive. They didn't care at all. And I'm a talker, so like I will sit and I will tell you things that are wrong, and I want help, you know. But they gave me a social worker, and her name's Nicole. She's with that WICSI group that's in Westmoreland County Social whatever. So if anyone ever needs like a little person, her name's Nicole.
Need a little person.
Yeah, needs a little person. But so she comes and sees me every month.
You know what? I could use a little person.
Yeah, dude, it's nice having a little person because she comes and just like vibes with me now.
Really?
She comes at your house.
Yeah.
So what?
What
does she do? Like, is she a therapist or?
Kinda. Like, she used to bring so much materials. Like, she would.
I didn't
bring,
know
like,
adults
tools.
could have social workers. I thought that was I didn't know.
She helped me with like a lot of like trying to get a hold of unemployment, trying to file for unemployment, trying to get a hold of like state
kind of like
reps.
your advocate.
Yes, kind of, because I had like, you know, Matthew was working, my mom was working, you know, my family was like, wasn't sure how sensitive. I think they couldn't tell how I felt about the pregnancy because I held it in pretty well. So I'm typically a pretty insensitive person. Not insensitive, but like I'll joke about
like
things.
Like super emotional.
Yes,
maybe.
yeah. Like I'll be like, oh, haha, you know, about everything. But so it was very much so like I needed someone, like you said, like an advocate. But yeah, so she comes and she'll still bring me like, hey, I saw this online if you needed any resources for this or like stuff like that. But yeah, there wasn't really any other like checkups in between. So like I can't imagine women that have had to like go through maybe like stillbirth or like horrible things because I felt like I was treated like not crap. Like I don't want to say I was treated like crap, but I feel like there was just some really insensitive things said to me.
Not like a human.
Yes.
You were not treated like a human.
Was not treated like a human.
Feelings and emotions and
yeah. They act like I was just, like, another patient. Like, when I get it to them, it's a little bit more normal. But this was something that, like, never happened to me in my life, and I never thought it would. So it was, like, I don't know how to react. Like, so you guys have to kind of, like, help me through this. Yeah, it was definitely the worst week of my life, I will have to say. Obviously. But, yeah.
Or, like, the worst year.
Yeah, it was a really tough year. Especially because after, like, my body is different, like, up to 5 months. Yeah, I noticed my hips are a little wider. I still have a little weight.
You were at the point your body was getting ready.
My body
yeah, because the second trimester, I feel like, is when your
Things
body's
change.
starting to get ready. And
Right.
that's when you start to show more. And
Yeah. Yeah, I had a belly, and I mean, you probably remember I would snap. I had a little belly.
Yeah.
I thought for a while I had twins because my brother and sister are twins.
Oh,
but
yeah.
but I didn't.
And you gained so much weight.
I was
I
just
gained
going to
so
say
much
that.
weight.
Yeah.
Yep. So I would say I'm still kind of coming off of like the weight still. I mean, thankfully it wasn't enough that like people can see, but like I can see.
I think you look amazing.
Oh,
So
it's enough.
give yourself
that,
some grace.
Thanks. But I can still see it and notice it. Like, I don't know how, like, you guys that have had babies can do it. Because I struggle super, super bad with, like, what I look like since I've been pregnant.
We struggle.
Do you?
We're all struggling really bad.
Yeah, it's tough. Like,
It is.
And I didn't
Everything-
even go the whole way. Like, I
Right.
couldn't imagine.
Yeah.
My hair's falling out in clumps.
So is
It's
mine.
fine.
Yeah, and they told me it could be from COVID, too.
Really?
And my
What?
blood thinner.
Oh, I had COVID while I was pregnant,
Did you?
but my hair didn't fall out then.
Yeah, they told
It was
me
after I
that.
had cash.
Because I have to wear, like, extensions. I lost, like, half of my hair.
I'm getting there. It's coming out in
crazy.
clumps, and Craig's like, "Is it growing back?" And I'm like, "I mean, not in the rate that it's coming out."
Not in clumps, yeah.
I'm like, "It's not growing back in
I'm
wads."
not,
like
I'm not
this."
losing hair, but I'm still like getting stretch marks. Is that weird?
Oh.
Like I didn't have a lot of stretch marks on my stomach, but I feel like I'm like still like gaining weight because of breastfeeding and everything.
Yeah.
And I'm just that's how it was like the first year after I had Basil. I got more stretch marks not being pregnant like after.
Really?
Well, your body is still.
Yeah, no, I'm always skinny pregnant. Like I
Doing
can't
different
eat
things.
and
Yeah.
like I lost 10 pounds the first. I never even gained a full 15 pounds
I don't
with
think
either
I
of my
did.
pregnancies.
Yeah.
That's crazy.
That's what I mean. Like, that's not really. No, I don't want to say it's not normal. I know people gain a lot of weight
Right.
sometimes. People can gain anywhere from like.
But that's what I mean. The
Yeah.
doctors are more concerned about how
Right.
much weight you're gaining or how big your baby's gonna be.
Yeah.
But what about?
What about me? You know,
Yeah,
like,
like-
that's what I was the whole time. I was like, what about? And I remember telling the people in McGee about like how my doctor really didn't give me any information. And I'll say it. I went to the Westmoreland OB over by Dino's in
Yep.
Greensburg, and they told me that they're a very
Oh, yeah, that's
like
what- yeah.
political practice.
Oh.
Oh, yeah.
I didn't
And
know that.
I didn't know that. And I mean, like, I'm political, I guess, but like, I still have feelings about whenever it comes to like.
It shouldn't be.
It shouldn't be
political.
political.
Yeah,
Yeah,
it
it's like this should be like a health
Yeah.
thing.
You tell me
know?
the facts.
Yes.
You tell me what the results are.
Right.
And you let me make my decision.
So I wonder.
But they were like that because I was pressured pretty hard to get the COVID vaccine
Were
while
you?
pregnant.
Interesting.
And at that point, there was not a ton of research done on women getting it while pregnant.
Yeah.
And now there is more research on it, and it's not really recommended. So,
Interesting.
I didn't know that.
But they pressured
yeah.
you to get it.
oh yeah, the same doctor that you saw.
I got a COVID vaccine while I was pregnant.
I
It was the day I found out I was pregnant. I was supposed to go get like one of my
But you were getting it
boosters.
anyways.
And I asked her, I was like, should I get this? And she was like, if you don't want to. And I was like, I mean,
Bro.
if I didn't take a test today, I would have still came to
Right.
get this shot. So.
And that's fine for you to make that decision,
Yeah.
but don't tell
Right.
me. She told me that there was all this research that it is safe.
No,
Right.
how
And
would
that
you know?
There is not.
Right.
There wasn't at that time.
Yeah. At the time, there
So
definitely wasn't.
right, and then I got COVID while pregnant, and it was nothing. I felt like I felt better with that than whatever I just
Than
had.
what your babies
Just gave
give
me.
us
Wow.
sickness.
And even after this, I was like, okay, well, I had COVID, so they can't really keep pressuring me, right? No, I had another doctor at one point tell me. Then it's funny because I remember the flu shot being very pushed when you're pregnant.
Mm-hmm.
Yeah.
I know a lot of my friends that were pregnant, and at the beginning they were all like, flu shot, flu shot.
Right.
And I said to the same doctor that was pushing me to get the COVID shot, what about the flu? Why don't you want me to get the flu shot? She's
Right.
like, oh, yeah, well, you probably should get that too.
Interesting.
I was like,
I've never gone a flu shot.
me
Yeah.
either, and I wasn't planning on it while I was pregnant. And then a different appointment with a different doctor at one point was trying to scare me into getting the flu shot. She was like, my brother just had it, and it was just terrible.
So, like,
And I hate those
That's-
moments because I'm not
yeah.
confrontational enough
Right.
to. Later on, I was like, man, I should have asked her.
Well,
For,
especially
her
we're
brother was.
vulnerable.
I was like, is your brother vaccinated? Is what I should have asked her.
Right.
'Cause,
Well, whenever you're in the
you
doctor,
know-
we're supposed to trust them. You know,
Right.
I felt so vulnerable when I was there, and I just felt like you
Nobody
just
was on
kinda
your
get it.
side.
Yeah, and you just kind of are hoping that they're being like in their best interest for you,
Mm-hmm.
and I'm just sitting there like,
They're not though.
I'm like, I really don't think you guys are listening to me.
No.
like, at all.
they
Like,
are worried about them.
Yeah,
Mm-hmm.
which is crazy because I'm like, what is this baby gonna do for you? You know what I mean?
CYOA, cover their own ass is what
Yeah.
it's all it's about.
yeah. And it's like they get to clock out. You know,
Yeah.
you have to go home and, like, with this, make these decisions. Like, they get to, like, leave at the end of their
Yeah.
shift. Which, like, we all know there's good nurses. They probably, I feel like a lot of them at McGee were just like ignorant. Like they
Yeah.
just didn't know.
I had a couple that were like amazing, and then a couple that were like I said, like you said, like ignorant, very much so insensitive. Or the one lady was like, okay, you're done getting blood work. I'm putting you on the do not whatever list. Because I was getting so upset. Like, I faint when I get blood work, and all they wanted was blood work from me. And I'm like, okay, I'm in here with a blood clot.
Stop taking my blood.
Yeah, I have a baby.
Keep it in there.
Yes. I'm like, I'm on a blood thinner. What do you need blood from me for? Like, so I was getting, I was not the best patient. But how could you blame me? I was literally in like the worst state of my life.
Yeah.
Like, you know, it was
You probably
horrible.
felt very isolated. I mean, I'm sure you
Horrible.
had visitors coming, but
All I could
you
have was
were-
Matthew. You're only allowed one.
what?
Yeah.
It's like your mom couldn't even come see you.
That's miserable
And I
sitting in
think-
that bed all day too.
Oh, yeah. I think at the
Oh my
time, if
God.
she wanted to come, then he couldn't.
Yeah.
Or it was like you could only have, it was just funky because it was still kind of
You're
COVID.
right.
COVID.
2021, yeah.
Yeah, it was still kind of COVID-y, I guess you could call it.
COVID-y.
COVID-y.
COVID-ish.
But yeah, it was definitely an experience I will never forget, for sure. I think about it every day. I actually was looking at pictures of me pregnant yesterday because I was like, oh, I'll be talking about it tomorrow. And I was sobbing. 'Cause
Yeah.
It's definitely something whenever you look back on it, it's like, what a blessing. But I just don't know if it was for me, you know? It's hard to
So
look at it that
did
way, too.
did anybody talk to you about like the future?
Yeah, that's
Yes,
good
a little
question.
bit. So
Like if you
'cause
were to ever want to.
they told me what I would have to do is I would have to
again.
get on those Lovenox shots again 6 months prior to conceiving. So
To,
I'd
like,
have
prepare
to be, I'd
for
have
it.
to be prepped, but it'd have to be the one that you take while you're pregnant. So I'd have to be taking the shots. I couldn't be on a blood thinner orally, but because I guess when you have one clot, you're prone to others. But then what's tough is they truly don't even know what caused the clot.
Right.
So it's like, would I need that, or was it a freak thing since I had COVID, or was it a freak
or
thing because
diabetes or
Yeah.
just
No idea. So they just told me that I would have to prep, and then my A1C would have to be around a 6 or a 7, which is like the diabetes number, and mine is not there. Mine's probably like an 8 or a 9. I'm not the best diabetic ever, but yeah. So that would be the only prep that I could try, and then they said that everything else should be normal from there, but it just scared me because I was like, I remember telling myself, if this is already happening to me at 5 months, what else am I going to endure within 4 more?
Yeah.
as the baby gets bigger.
As the baby
and
gets
that's not
more.
even labor and delivery.
Yes, which was the most terrifying thing to me ever. Like, I don't know how you.
I mean,
ladies
it
do
is for just
everybody probably.
normally. Like
Yeah.
I was terrified to give birth
Yeah.
too, and I didn't have these other things to be concerned about. So
Oh, I was terrified. I remember them asking me like, you know, the same thing in the beginning. Like, are you gonna deliver vaginally? Are you gonna have a C-section? Well, you'll probably have a C-section. Yeah, you're gonna have a C-section. You're diabetic. And I'm like,
Well,
okay, then I guess I'm gonna have a C-section. Like,
was that a
Great.
decision you guys just talked about internally to yourself?
exactly. Yeah.
Yeah.
I felt very much so like
Out of the loop.
very out of the loop. I was like a little science experiment or something. I felt like I just laid there all day, and they just basically let me like
Poked and
rot in a
prodded.
bed for a week, like until I made a decision. Which I'm like, aren't you guys like, shouldn't you not want me in here? And then they did move me again. They moved my room because I complained, and they moved me, which it was
Out
like
of the
last
new
3
mom's
days out of
suite?
the new mom's floor.
Yeah.
Yeah, they put me on like the whatever, like the concerned floor, whatever that would be. Anyone with complications, basically. is
Okay.
Which
where I
would
went.
be way more fitting from the
Yes.
get-go
Yes, yeah. Instead
than
of
the new
mother's
mom
floor.
because
That
like
I could not imagine that. I could not imagine like my first pregnancy and seeing all these like the families, the new babies, like, and then they're sitting here and make a decision.
Yeah.
So like, what is it today? What's your decision?
Yep. Yep. I remember, like, you know how whenever you're in there and, like, there's always that one lady that's like, hi, I run the floor.
Yeah.
I'm like, the whatever. That's who I freaked out. I started bitching so bad. I was like, listen, I was like, I'm in here. I'm about to lose my baby. They have me on the new mother's floor. They have me here. This is what's going on. And she was like, oh, God, no, we're not doing this.
Yeah.
And then she's the one who ended up moving me. I'll never forget her either. But, yeah, it was definitely tough. And, you know, Matthew was... We were both young at the time. Matthew's younger than me. He was only 23 when this was happening. So I think for him, it was just like really,
It was a lot.
yeah, because Matthew's very emotional. For those listening, he's a Cancer. We were just talking about his zodiac. But he's very emotional. Love you, baby. But he was very excited. And yeah, he was very excited. And he was very much so, like, if we have this baby, like, I'm going to be the best dad I can be type of thing. But if we don't, like, I understand why.
Yeah.
But I think, like,
Very
seeing,
supportive.
like, yeah, very supportive. But, like, seeing, like, the families and stuff, he wanted, like, that family, like, sense. And I was just not there to have that. Like, I wanted it, but I was just so engrossed in everything going on.
Yeah.
it probably wasn't going to look like that.
Probably was not.
Was the
Especially if I was a
problem.
long-term McGee resident.
Yeah.
Oh, my God, I would be down there, like, literally living there. There was the one girl on the complications floor did live there full time.
Oh.
She had already had the baby, but she was there for her pregnancy, and she was there, I think, like said, 3 months after. Yeah.
Oh, my God.
Wow.
Yeah, and that would have probably been me.
And you, at this point, don't know anybody that's gone through something like this.
No,
to
never.
even know what their experience was like to kind of talk through it.
Right, because the most I hear is like, so-and-so may have had a miscarriage. Oh, that's awful, but they're doing better. Okay,
well,
great.
I didn't even know this was your story.
Yeah.
I thought you, like, did have, like, a...
Yeah, we weren't sure if it was, like, an ectopic or...
Yeah.
I guess it was a high-risk pregnancy.
High-risk pregnancy.
Life-threatening.
With no answers.
Yeah.
Results.
Pretty
You
much
really
no
didn't
answers.
even know why it was a high-risk pregnancy, actually.
Yeah, pretty much.
So what do you think? Would you...
Like what? Try again?
I don't think it's worth going through all that.
I don't think it is either. I remember whenever I left the hospital, I asked them if I could do, because I had one nurse that was real cool at the end. After they moved me to like the correct floor, everyone kind of heard my story, and I was like a little advocate in the hospital. I was like, okay, girl, a little celebrity moment. But I'm like, yeah, I just suffered for a week. But the one girl was real cool, and she was like, you can always do a surrogate, like, or you can always adopt, or you can always whatever. She was like, you don't have to do this again.
Yeah.
That was nice.
Like,
That's probably nice to hear.
And I was like, you're right. I'm like, I guess I don't have to. And funny enough, like Matthew's brother lives next to a woman in Greensburg that her full-time job is surrogate.
Really?
Yeah.
No way.
Mm-hmm.
I low-key want to be a surrogate.
Dude,
Really?
the
Yeah.
universe
every
is so
year.
wild.
Yeah.
I'd never met a person that was a surrogate.
I've never, like, I never
Wow.
truly met her, but, like, he has met her from living there or, like, whatever.
But still, the fact that you are in that circle that
Isn't
knows
that
her is
strange?
just
that,
weird.
like, someone there, like, just, like, it just
Yeah.
opened my eye that, like, people like that do exist. I'm
Yeah.
like,
Yeah.
oh, okay. So, like, but I don't know. So I think I'm okay just vibing, I think. I don't think I'm
You can
ready.
Kardashian it.
I
You
can-
can Kim K
I
it.
can Kim K it.
Surrogate.
I could
Chloe.
surrogate it. Yeah.
Surrogate it.
I could surrogate it real quick. I could surrogate it
Put
real
that
quick.
thing down, flip it, and reverse,
reverse it.
Surrogate it.
I sure could. Because I don't know if, like, this sounds awful, but I'm, like, really selfish, I think.
No,
So, like,
yeah.
I'm like,
It's-
I don't know if I could do it. Like,
It's
you guys
And you
hard.
don't have to. That's the
Yeah.
thing. Kids are not like the one everyone's like that's end game goal, life's
everybody.
purpose.
Yeah,
No.
it's not for
Stop
everybody.
asking women when they're gonna have babies.
Yes.
Just like stop.
Yeah, I
Because-
just wanted to know.
Customers ask me constantly, and I had
No, I wasn't meaning that towards
I know.
you. No. But like, you know what I mean?
Yeah.
When you get married
Right.
or you're in a serious relationship first, when are you having babies?
Right.
I've already had people asking me when I'm having another
I'm like,
one.
ma'am, I can't. Like, thank
Yeah.
you for asking.
Well, and you know what? That is a good point to bring up because there are women who cannot get pregnant,
Right.
and it is, and I don't think anybody ever means it in a way that they're trying to be rude about
Right.
it, but it's just something to kind of keep in the back of your mind.
Yeah,
that maybe it's not a feasible thing for every woman. Maybe they
Right.
really, really want it and they can't have it. Maybe they don't want it,
Right.
and that's okay. Like
And
we
then I
don't
do
just
get-
because you're a woman doesn't mean you have to produce children.
Exactly. And I get scared too because, like I said, my brother and sister are twins. So I'm like, what if I were to try again and, like, I got twins?
High risk
and then
twins.
High risk pregnancy.
And you have to go through all of this over again.
all of it. over
Or
again.
in like a
Crap.
different way.
Yeah. I'm like, I don't think I could do it. Like,
No.
it was a lot on my little body, man. I'm telling you, like, I still, like, even just talking here, you can probably hear, like, I struggle to talk still. Like, it's still hard for me to breathe. I've been trying to go to the gym for the first time ever. I wasn't allowed to work out because of the clot, because I couldn't breathe.
Yeah.
So I've just joined the gym again. I'm trying to, like, get moving and stuff. But I'm like, that pregnancy really, like, messed up
Took
my
a
body.
lot out of you.
It took a lot
Yeah.
out of my little body.
I was gonna when you were saying the selfish thing. I don't think you're
Like
allowed to
selfish
feel
is the right
selfish.
word.
Yeah, because even when I found out I was pregnant and all throughout my pregnancy, and I was talking to my coworker who's pregnant too about this, is you kind of have a moment. I don't know if this happened to you at all, where you just sit there and you're like, "Holy shit, I'm about to have a human
Right?
Yeah.
forever."
Mhm.
Like this isn't
Like,
just
this isn't just temporary.
this
Yeah.
isn't just picking up a dog or a new cat. You know,
Yeah.
this is like a human being.
Yeah.
Right.
And your life forever is going to be different. And
crazy.
I kind of almost think you grieve your old self, your
Yeah.
old life, because it's not, you can't just run it. I mean, it depends on who you are, but you can't just run into Dunkin' Donuts, you know? Depends on what,
Me,
second
pregnant,
time up.
I'd be like running around.
She
No.
knows I'd run into Duncan.
No, it's
With the
literally
kids.
fine. You can. That
Yeah.
was a bad
No,
example.
but
But,
it's-
you can't
yeah.
just like quickly go do the things.
Right.
I do it all the time. I'll be in the car and I'm like, oh, I should just like quickly go to Shop and Save. I'm like, oh, I gotta get the baby out.
Yep.
Yeah.
Put on the carrier.
Bundle
put
them
on the
up.
stroller.
You can't just
Yeah.
go to the
Pulled out.
tanning
Run,
bed.
Can't just go tan real quick. Can't.
No.
Right.
Oh,
like,
God.
Yeah,
something
stuff like
wild.
that.
Yeah.
I
I don't think I
can't.
could do it.
Nobody's will watch my baby so I can go tan.
Yeah.
I can't bring her. What am I
I
gonna like?
guess
Just
you
no.
Put her in her-
Like, hey, can you watch her really quick?
Yeah.
Your baby Bajorn.
But
Beside you.
but like
rays,
what?
dude.
Turn her the other way? Because like
Yeah.
the rays get out.
Oh.
When she starts crying.
Just stick your foot out.
It's just stuff like that. You know, I
Yeah.
can't go get my nails done
Right.
if I'm
It's
not
a whole
working.
new, so I think it's normal to feel
Right.
like you want to be selfish because being a mom is so self-led. Like
Yeah.
yourself is less and less because you have this other
Right.
person.
That's what
relying on
I
you, so-
literally was so like when I went to therapy right before I met Matthew. I was in like the peak of my life, so I'm sure I wasn't one of the like you remember.
Same.
I was on.
We
I
were
was
on the
my
same
game.
level.
Like,
Yeah.
It was just like I looked great. I was like my body was the best it ever looked in my life. I was at an awesome weight. It was
25. Was that when we were 25?
Yeah, 25, 20.
Yeah. That's why I said Carly and I say we want to be 25 forever.
Yes.
Yeah.
She gave me a birthday card this year. It said happy 25th. We're just going to be 25.
Like, I'll relive that. Like,
Yeah.
I was just glowing. Like,
We were
I did
having
what
a
I
great
wanted.
time.
Yeah, I was single. Not that I don't love Matthew, but, like,
Yeah,
life was
same.
just easy.
Yeah.
And, then I met Matthew. Everything was great. But then all of a sudden, this pregnancy, I'm like,
You were at your
holy
highest
hell.
high.
And then my lowest low.
Brought back to
Like,
your lowest low.
So crazy. And I was, like, really grieving myself. So, like, for moms that are struggling with that, like, I can only give you so much credit. Like, I can't even give it because I was dying. Like, so all the credit to you because I couldn't even grieve as far as I went. Like, there's no words. It was tough. So I don't know how you guys do it.
We are glad you're still with us.
Hey, thanks. Me too.
We
Glad
know,
I
I
didn't
know
lose
that
myself.
you've had a lot of near-death experiences, it seems like. Please
Just
stay
like
out of
life
the
on the edge.
hospital.
I'm a little evil Knievel, like a little daredevil. Yeah, I'm a hospital girl with my keto, my ICU, doing dumb stuff with my car all the time.
Yeah,
like,
stop.
Yeah, and then the pregnancy, I was like, wow, everything I do just has to be to the extreme. Like,
Yeah.
High risk.
I'm a high risk girl.
High
like,
risk. High
like,
reward.
high
I don't
risk,
know.
high reward. I was like, but that was another thing too. To be honest, my mom kept telling me that she's like, this baby might be the best thing that's ever happened to you, and I'm like, Mom, the risk is crazy.
Yeah.
Like, yes, the reward is crazy too, but like,
Yeah.
I might not make it.
Is it though?
Like,
Like,
is
how
that
do you
worth
know?
it? You
Right.
know?
I'm like, it's a 70%. That's a large amount that I might not make it. Mm-hmm. And I had to pick me. I had to pick me.
Because you're selfish and you're allowed to be.
Yeah, yeah.
Keep your cats in
and
your
it's
car.
so hard
Yeah.
for anybody to even say what would, like, for that one nurse to tell you, oh, you're gonna pick
Yeah, you're going to pick needles,
not doing
whatever.
shots.
Mm-hmm.
Like, you
Yep.
can't until you're in that. I can't say what I would do.
Yeah,
I would say what I think I would do,
right.
but until you're actually there, like sitting there in the hospital
Right.
with these scenarios,
Yep.
how do you know what to do?
Because, like, even if so, let's say I was a tough cookie and I took those shots, that baby could have still, like you said, like, not had a spine. I would have known.
You could have done everything.
I
And
could have done everything.
Could have still lost. the baby.
no, well, the heart. But yeah, no spine, no brain. That's...
Or at the worst, extreme complications,
Mm-hmm.
and God forbid I want to bring a life into this world that has to live an awful life because I wasn't prepared,
That's
when it
very
comes to
true.
health. Right. Because just because I don't take care of my diabetes, it's not fair that my child should have
To suffer.
or have diabetes. Like, even that in itself
Mm-hmm.
is tough for me. Like, I don't want to even have children sometimes when I think about that because I don't want to give them that burden,
Yeah. No,
It's
that's
definitely
tough. I had, because you have to take that glucose test
Yeah.
when you're however far along. Drink that drink,
Mm-hmm.
and I did it, and I threw it all up. It
Did
was,
you?
Oh yeah, it was terrible. It was the worst experience ever. It
Because
was.
there's so much sugar.
Well, yeah, it tasted good because I was worried about it tasting bad. So I
Yeah.
drank it. They make you drink it in 3 minutes.
Oh, my God.
Yeah, they time you.
I
It's
feel like
half
just
of a
give me
water
coffee.
bottle. 3 minutes, right?
Literally, my
No, there's
daily
no-
coffee is probably the same.
There's
Probably
no
the same
other
amount of sugar.
options but this highly disgusting sugar drink. There's no other, they don't tell you any other options at the beginning. They just make you take this drink.
Yeah.
And you're sitting there in the waiting room. I'm at Excella.
Mm-hmm.
You sit in the waiting room with all these people wearing a mask. And I'm like getting really warm. I'm like, I'm kind of sweating.
You were going to faint. Or
No,
throw
I was
up.
like, maybe I need to go to the bathroom. And I knew there was a bathroom right beside the room. So I like step out because you're allowed to like pee and stuff. So
Right.
I was like, I'm going to go to the bathroom. So I like go over to the door and it's locked. I'm like, shit, where's the other bathroom? And at this point, it was like 0 to 100. I'm going to throw up right now. And luckily, I saw there was another bathroom across the hallway.
Yeah.
I barely made it in the bathroom. Didn't get my mask off. Puked in my mask. It was just everywhere. It was on my clothes, in my jacket, my shoes, the floor.
An orange.
Orange.
Oh,
It was
God.
disgusting because you're not really. I didn't eat anything. That was probably part of the problem.
Right.
I was mortified. I was just sitting there like, what do I do? I'm just covered in vomit. Like,
Oh my
it's in my
God.
hair. I just spit all of it up. So
Ew.
what? Do I have to drink it again?
Some of the pregnancy things they make you do.
Yeah,
is
and
like,
I go back in. I'm shaking, and nobody comes in to check on me. Like, I just disappeared for 10
They're
minutes
like,
because I'm like
"Hopefully
cleaning
Courtney's
up.
okay."
I'm cleaning up. I'm puking. I'm cleaning it all up, and I have to walk back in there like the freaking walk of shame, covered in my own
Oh,
vomit.
God.
And I'm standing there, and first of all, they're so rude. I get it's your job. Maybe this is not the career path you should have chose.
Right.
If you don't want to deal with pregnant women all day.
That's how I felt. Yeah.
Like, and the girl was so rude. I'm like waiting. I'm like just standing there awkwardly with all my stuff covered in vomit. I had to take my coat off because
They're probably like, can you take a number?
yeah.
Yeah, honestly.
She's like looking at me so irritated. I'm standing there. I was like, sorry, I'm like in tears. I'm like, I just threw that all up. And she was like, oh no. So do you need to reschedule?
Oh my
Are you
God.
kidding me?
I was like, I'm just gonna go home right now. I'm not coming back to do that again.
I'd be like, girl, we're going to reschedule a little bit more than just this.
Yeah.
I'll see you next time.
Yeah.
That'd be-
And I've like had my next doctor's appointment. They were like, you didn't do the glucose or you didn't do the glucose test. I'm like, no, I threw it up. What are my other options? Because I'm not doing that.
Were there other options?
Yeah, they had me do the at-home diabetes test.
Oh, and they could have just had you
Prick
do
my
that in the
finger.
first place?
Yes. So I kept it because if I ever have another baby, I'm not even doing the
Girl,
drink.
just call me. I have a million.
I know. I should have. Well,
Jeez.
I was.
I'll be like, I'll come check your sugar. I'll be right there.
I
Half a
should
mile
have.
away.
It's so. That was the point of this story.
Yeah.
Was I give you so much credit for that because that was
Yeah.
hard to do that.
Yeah.
I had to do it every time. I had to do it 3 times a day. I think.
Yeah, I do it every time I eat.
Yeah, it was like either I forget if it was right before I ate. I think I had to do it both. I think I had to do it before I ate and after I ate to check the levels. But yeah, it was hard, and
Yeah.
I like couldn't get
And
the
you've been
freaking
doing that
blood
your
out
whole
of my
life?
finger.
Since I was 9, yeah. Yeah.
That's
That
crazy.
sucks. Yeah. I just ran out of insulin like right before I came, so I was like, I have to make sure I run to Walmart today and get my insulin so I don't die.
Like,
Literally. Like, period, you know? I'm like, it's so true though. Like
Yeah.
it is, it's crazy.
How does that work? Your insulin.
So every time I eat, I have to give insulin to counteract my food because my pancreas doesn't work.
Okay.
So every time you eat, your pancreas produces insulin, so it keeps your sugar down. But obviously mine doesn't work, so I have to give insulin. But if it drops, then I have to eat to bring it back up.
Eat sugar.
Yeah, eat
Yeah,
sugar.
my
or
aunt
carbs.
always has like
Carbs is
Smarties on
mostly
there.
it. Yeah.
Oh, yep.
Yeah, carbs is what impacts the blood sugar. So that's why it was so interesting when I was pregnant, too, that they were, like, kind of not so concerned about my diabetes. And I'm like, shouldn't you be? Like, I'm like, that is a huge thing.
Well, because that's why you take the glucose test to see
Right,
if
to see
you
if
have
you have
gestational
the-
diabetes. Yeah, because it's very common for
Yeah.
women.
Did you have it or no?
No, I mean
Did you?
the test.
No.
No.
I'm surprised. I eat and drink like a lot of sugar.
Really?
I'm surprised I didn't.
I don't. I think it's the way
It processes.
the baby processes it.
Probably.
I forget. I
It's
forget
interesting 'cause
exactly.
my mom didn't have it, and then I'm diabetic.
So it is super like genetic.
Mm-hmm.
And your siblings don't?
Nope. They did like so much research whenever I was diagnosed when I was 9 at Children's Hospital. Like my parents signed up to do all the research and stuff because my mom was like so determined to figure out like how I got this diabetes thing. And
It was random?
random. There is a possibility that my dad's dad may have had it, but he doesn't talk to, or like he's been, no longer like he's passed away since. But my dad wasn't really like super close with his grandfather, so we weren't super sure. But other than that, there was nothing in the DNA.
Yeah, nobody
anywhere.
else in my family has it either.
Yeah,
so
isn't it
that's
crazy?
Yeah,
It's like.
and she was pretty young. She was probably younger than 9, I think.
Really? Oh my
think, I
god.
forget.
See, and it just when I was 9, it was traumatizing, so I couldn't imagine.
Yeah, you're
it
this
being-
little child.
Right.
I didn't even give blood work till I was
Pregnant?
out of high school.
Yeah.
No, but
Yeah.
close.
Yeah.
It's the worst.
So I couldn't even imagine. I would be mortified to
Yeah.
have to do that as
Literally,
a child.
it was
and
the
then to
worst.
go, and I had to take this diabetes test like to work. We had like an in-person meeting. It was only one day because I worked from home, and I had to take it. And I had to like go to the bathroom because I was like, I don't know, should I do it in front of everybody? Because
Oh, I just
Yeah,
would whip
I-
mine out in
well,
school. Yeah.
yeah, now
'Cause you
you
get
just
used
become
to it. But
comfortable
like,
with it.
yeah, at first you're like, I remember I'd go
Like,
to the nurse's office to check
awkward.
my sugar at lunch and stuff because I like felt like weird about it. Because yeah, you do. You feel awkward and you're like, everyone's looking at me.
Mm-hmm.
Like, is this normal? And I don't know. Yeah, but I totally trust me
as she drinks her large
get
iced
it.
coffee.
as I drink my large iced coffee. It's okay. Splenda.
Sips
Splenda
coffee.
in there. Splenda in there.
Splendid Splenda.
Very splendid Splenda, definitely.
It's good.
But,
There's
and,
like
I'll drink
options.
my sugar free when I go to Starbucks. So yeah, I everyone's like, how do you do that with diabetes? And that's what my mom kept saying, that while I was pregnant, all I wanted was iced coffee. That's all I wanted. And my mom's like, you can't have it. I'm like, please.
I drank iced coffee the whole time.
Did you? Oh, they told me, no, you can't have any of that.
You're allowed
You're allowed like 200 milligrams a day.
Yeah. Are you serious?
Yeah.
They told me nothing.
I drank a couple Red Bull.
Did you?
Yeah.
I did go get one of those.
I didn't change much about my life.
Listen.
See, that's why you had a great pregnancy. They're over here like schooling me. I was like, oh my God, can I live? Like, let me be. I think that's what honestly gave me made it feel like I lost myself, because I really,
you weren't being yourself.
I wasn't doing normal shit, you know? I really wasn't.
I still got to take my meds. Like Zoloft is like pregnancy safe, breastfeeding safe.
Wow. So yeah, I wasn't on Zoloft. I was on Wellbutrin.
Yeah.
Which it was not, I don't believe. Or and if that one's like it actually was giving me seizures, so I had to be super careful.
I remember
that one too.
I remember that.
Yeah, so they wanted me off of that just in case. And then the other one, they had me stop until I was no longer pregnant. Then I took that one again for bipolar, which was interesting. They took me off that too. So don't know. Yeah, don't know. Just a mess, man. Just a mess.
I'm glad.
How are you today?
Yeah.
Yeah. And it helped me, be who I am today. So I hope like anyone else that's going through anything like that or thinks they might have, I don't even know, like anything's possible, and just trust, I guess, your gut, because I knew from the, you remember, I knew from the get-go. I was like, something's not right.
Yeah.
And sometimes the doctors just don't know. Like, and I just had to keep insisting. I'm like, I can't breathe. I can't this. I'm telling you I can't breathe. I'm telling you I can't lift things up. Oh, really? Oh, really? I'm like, yes. Like, you're not me, so you don't know,
Yeah.
So
they aren't seeing the changes that you are.
Yeah, exactly. They don't live the life, So, yeah, it was definitely, I'm glad I went that day. Because if I would not have, and they finally gave me information, by the way, too, on Planned Parenthood, the very last, my 4th appointment. So that would have been my 2nd trimester. So I don't think I could have even gone to Planned Parenthood at that point. I'm not sure how it works, but I don't even know if I could have. And then they told me that because of my diabetes, they probably wouldn't have taken me anyway.
Because it was a high-risk situation.
Yeah. Yep. I'm like, well, gee, thanks. Thanks for the info, guys. That was excellent of you.
Yeah. That would be hard to make that decision with zero information or zero explanations.
Horrible.
So.
Yeah.
Well, I'm glad that you are here.
Thanks.
And
Me too.
I'm really glad that you felt comfortable enough to come on here to tell this story, because it's very unique, but I'm sure there are other women out there that have similar situations.
I'm sure. Especially like I hear about a little bit more commonly now about like the blood clots just being like a COVID thing. Like I have kind of heard about that.
With women.
Yes, with women only.
Specifically, yep.
Yep. So even if
I didn't know it was
pregnancy,
like in your lung. Well, I guess that makes sense if COVID is respiratory. Yep, that makes sense.
Because I asked the same question. I was like, what the hell? It's like a flu. And they're like, well, no, it's a respiratory flu.
Mm-hmm.
And I'm like, I guess, bing, like little light bulb went off. I'm like, I guess you're right. That makes sense.
Yeah.
But hopefully, other women can just be aware, because who knows? I might have had the blood clot way before I was pregnant.
Right.
Who knows? Maybe the pregnancy helped save my life that way. There's so many different ways to think about it. Yeah.
Didn't think of that.
But thanks for having me.
Yeah,
it was hard to talk about, but it was also like, it feels good sometimes to get it out.
Yeah.
And talk about it a little bit and just kind of, it's so crazy to think that happened. It's like one of those things, but by the time you blink, it's over with. Because I'm one of those people with trauma, I try to forget it.
Yeah.
So, but that's one, it's not easy to forget. So, but I try to kind of just get through, get through the motion and just live it each day. I think about it all the time, but it's one of those things that
I think about it all the time too.
Yeah.
And I feel like a lot of people were probably like a little curious as to what happened, because you did post about it.
I did. And I'm not like, I'm a social media person, but I'm not when it comes to like private things. And to me, that was like
something
pretty private. Yeah.
You didn't need to.
Right. And I think
until you were ready.
And the only thing that I did post was, and I'm kind of glad that I did, because I did get a lot of support, was when the baby was due. Like we said before we started, I was due December 15th, so I would have had a Christmas baby, which would have killed my pockets. So maybe it's a good reason I did not, because I would spoil that baby. But I was due the 15th of December, so last December 15th I was at work, and I went to my office for an hour for my break, and I cried, and I just like got it all out, and I posted something on Facebook. And I'm not one of those people, but I got like a ton of support, which was nice, and from strangers and stuff. And it just was like, it was just nice, because I'm like, it's something I wouldn't really talk about. Who do you talk about that stuff with? It was one of those kind of like, I didn't know, like you said, anyone that went through anything like it.
Right.
And if other people did go through it, they probably don't talk about it like I do either.
No.
So it was kind of nice to see that other people were interested in, like, just being supportive or just for, like, sending prayers or just anything. So kind of felt nice. But I'm sure I did keep it in the dark a lot. And not that many people knew I was pregnant. I want to say maybe, like, a handful, like 30 people.
Wow.
Yeah, I really didn't tell anyone. I never announced it or anything because I just kind of knew. I knew something. I, like, had these, like, ideas in mind on how I was going to do something with a car or something corny.
Oh, yeah.
I was going to put the ultrasound on the wheels before we put them on the car or, like, something corny. I don't know. But I just didn't. I told my family, and I told, I told you. I don't really remember who I really
Sam said that you talked to her a little bit.
I told Sam a little bit. And then I told, she's super, super nice, and I don't really know her. I wonder if she listens, because she's a mom, too. Devin Workowitz?
Yes.
She had posted something about being pregnant, so I slid up to her, and I told her, and she gave me, like, some nice little words. Like, so there were people like that, if I saw that they were pregnant and, like, looked really happy and healthy, I would, like, slide up, and I'd be like, hey, like, I'm pregnant. Like, what is it like? Whatever. And that's kind of, like, how I would get it out.
We want that. We talked about that on this last episode that isn't posted yet, but we talked about how you want that connection.
Yes.
That's why we all
That's why I think we're even doing this.
Right. Yeah. Like, to connect. Like, yeah, because there's other people. And especially in our age group, like, there's a lot of pregnant people right now.
Yeah.
And they're going through different types of... I mean, look at how many different stories we all have had.
Right.
It's like, it's bound to happen that someone has something different. So anytime I saw someone that was, like, pregnant and, like, cute and happy and, like, doing their thing, I was like, hey, like, by the way, I'm pregnant. Don't tell anybody. Yeah. And they're like, oh my God, congrats. And I'm like, well, I don't know how to feel, Right. And that was kind of how I would, and I feel bad for, sometimes I'd be like, I would do that and people would be like, oh my God, congrats. And I'm like, well, I don't really know how to feel. Sam was one of those people. And she was like, it's okay,
I know a lot of people that the way they respond to people saying that they're pregnant, they're like, all right, well, how do we feel about this?
Yes.
Which I love.
Yeah.
Like, that's so, like, oh my God, because I'm immediately like, yes, baby's pregnant. Yes. But I'm also trying to be more conscious about it. Like, how do we feel about this? Right. Like, let's talk about our options. Right. Like, you want to, like, be that open friend for support.
And it definitely, like, it opens your eyes in ways, like, politically now, like, with things that are happening in the world, like, again, like, I'm not, like, a super political whatever, but, like, now that I've been through, like, a situation like that, it helps me understand more.
With women's health care.
And women's rights and women's things like that. And I'm like, wait, I am a woman. Like, if things were different, I may have never, well, maybe because of the health I would have been able to, but what if before the health, I would have not had an option. Yeah. I don't know. So it's definitely, like, living through that taught me a lot, for sure.
I thought about that a lot whenever things were, like, in the news. Yeah. I'm just like, Jay had to go through this. Like, what if she didn't have that option?
Right, exactly. I think about that, too. Especially, I had a woman at work that I was doing her makeup, and she was very gung-ho about no abortion. And I just let it rip. And I just started talking to her, and it was...
Oh, like, you told her about yourself?
Straight up about everything.
God, yeah, I would do the same.
Yeah, and I was like, yeah, I totally agree. However, and I... just kind of nailed her.
And I'm doing her makeup. It's a gray area. It's not as black and white as maybe people think it is.
I think so too.
Because if you don't hear these stories, if people aren't speaking up with these scenarios, then you don't really think that they're as... And it still could be pretty rare, but maybe as common as you think. Like, I know somebody personally that has gone through this that it would affect. So I think it's important to tell. Yeah. And I think that's okay. You should.
Yeah. And she was, like, very susceptible to it and, like, really, like, receptive and listened. And was like, and it probably changed how she felt. Yeah. Or at least a little, I'm sure. Even if it just helped a little bit just by being aware. Yeah. I'm like, just know that people do go through stuff like this. Mm-hmm. And thank God that...
And I think it's important to acknowledge that.
Yeah. I'm like, thank God that I had the resources that I did, because I would have either had a baby...
Would you be here right now?
Yeah. Or I would have... Matthew might have a baby right now and I wouldn't be here. Right. Yeah. Or you never know. So... Definitely crazy to think about. Definitely.
Well, thank you for sharing your story.
Yes, thank you for having me.
Yeah, we hope that it resonated with somebody, and if you're feeling the need, reach out.
Yeah,
if you want, we'll plug Jay. We should do a little intro for Jay. Send us pics and a little bio. We're gonna add
Me?
you. Yeah.
Okay,
Yeah.
do a little intro.
Yeah,
for me.
we're gonna add a
All
little
my pictures
intro.
are with my booty out though. I gotta
That's
chill.
Put your
our
booty
favorite
on.
type of picture.
Your booty, your cats.
I'll be like, this
your...
is me. I'm a cat lady. Here's my car, my butt.
Yeah, but then so
you
we can
know.
put your social media on there, so if other
Okay.
women feel like they want to
Yeah,
connect
because
with you,
I would
think-
definitely like now that I feel more open, I would like to talk about it. I think it helps when I talk about it, and I went to therapy, and I still actually my therapist just broke up with me, so yeah, so that was not the coolest thing, but
didn't know that was a thing.
What?
yeah, she was basically like, "What are you trying to get out of this therapy session?" So hopefully she's
Man,
like,
are we getting
Therapy.
married?
I'm like, I'm trying to have someone to talk to that's not
Do
Matthew
you
or
need
my mother.
commitment? Like,
That's what I'm like.
should
Yeah,
I get down on one knee?
but it is nice because I don't always feel the need to talk about the baby, but it's always in the back of my head.
Mm-hmm.
So whenever someone does want to talk, it is like refreshing. I'm like, yes. I'm like, I do need someone to talk to this about. So yeah, if anyone feels and want to, have any questions or want to chit chat or have concerns, like I'm all about it for sure. I'm definitely feeling more open to it and
Good.
not as closeted and hiding like I was. But it was one of those things like, how do you talk about
How do you
that?
even start? How do you bring it up?
Yeah, like,
Yeah.
oh, by the way, I lost. Listen to this crazy story. you
Yeah.
know?
Well,
Like,
yeah, and what are you gonna do? Tell that to somebody that just told you they're pregnant, and then
Right.
then terrify them, and they're
Exactly.
like, "What?"
Oh,
So
yeah.
it's
Right.
True.
it's tough, but
Yeah, definitely.
it was a good way to get that story out
Yeah,
there. So.
definitely, for sure. So for anyone that was curious, that's my crazy little story.
Jaden's
my crazy
story.
story. Yeah, it's definitely fun. So, but like I said, thanks for having me. And if anyone, if it resonated, I'm glad. And if it didn't, just to raise awareness or anything like that too, because anything is possible in the health world, especially if there's like diabetes is one of those things where any complication can kind of come with it. I've learned anything that happens to me is more extreme because of diabetes. So if you have anything underlying and you're thinking about getting
Just be
pregnant
mindful.
or just keep an eye or try to be a little proactive if you can was kind of what resonated with me from the doctors. They said like I could try again if I do this, this, and this. So, there isn't a not necessarily you can't, but just be very proactive and very aware is what I would say.
And
for
know you're
anyone.
not alone.
Yeah, know that you're definitely not alone. I felt very alone, and then I was like, you know what? I'm a little post on Facebook, and I felt
See what
really,
happens.
yeah,
Good.
felt really definitely supported, which was nice.
Well, we support you.
Hey,
Yes.
thanks.
All of
Thanks,
us.
girls.
Well,
Appreciate that.
we'll see you all next time.
Yeah, sounds good. I'll come back. I'll come back and
Yay.
chat with the
Yes.
moms.
Yeah.
Heck yeah.
I'll bring a cat. I'll be like, this is my newborn. We're practicing for maybe one day. Practicing. A little bit cheaper than diapers, cat litter. Actually,
bit.
probably not, but it's okay. Not the way that I have to buy it. I gotta buy it in bulk.
Oh my gosh.
All right.
All right.
See you next time, guys.
Bye.
Bye.
Goodbye.